Hi, everybody. I'm Bryan Mudd. A fan of South Plains politics? Here's your talking points for this week. Tax revenue is down, even with businesses reopening, so as many Texas families have to do more with less in this COVID economy, so will the Texas government. And more aid is coming to our struggling farmers and ranchers. We'll have a closer look at how the virus has caused turmoil, even in so-called essential businesses.
From the studios of KAMC Television in Lubbock, your local election headquarters. This is Talking Points with Bryan Mudd.
Thanks for joining us, everybody. Also this week, our lost spring. The Memorial Day weekend sneak up on you, too? I mean, we basically skipped April, which has really thrown things out of whack. Very little still looks or feels the same, but it's better. And the way back to the same will be slow, kind of by design and kind of by fear of making things worse. So KAMC's Wes Rappaport navigates us now through the start of a summer like none other.
The streets around the Texas Capitol looked as normal as they have in months as office buildings began to reopen with limited numbers Monday.
Our goal is to find ways to coexist with COVID-19 as safely as possible.
Texas bars and bowling alleys at 25% capacity with social distancing guidelines in place, hand sanitizer available, and dancing discouraged. Restaurants can expand occupancy to 50%.
Do everything you possibly can to continue to slow the spread. If you do that, there will be more opportunities to open up the state even more.
Abbott highlighted two key metrics he's using. First is the 7-day positive infection rate. That's the number of positive results out of the total tests over a week. A month ago, that was nearly 14%. Now, just under 5%. And he's following the hospital capacity. But Texas Democrats say the governor's analysis of the data is misleading.
Today it's clear he is simply cherry-picking the data. The governor glosses over the fact that the number of new cases reported has grown in the last 2 weeks. He glosses over the fact that the number of deaths reported tragically has increased in the last 2 weeks.
Democrats criticized the state's testing ability, which the Republican governor says has grown exponentially.
In just the first half of May, we more than doubled the number of tests that were given in all of March and April combined.
In Austin, Wes Rappaport, KAMC News.
And what's next? Well, pro sports like baseball, golf, car racing can come back on the 31st without fans in the seats. Youth summer camps can begin at the end of this month, summer school on June 1st, and the kids can start summer sports workouts June 8th if everything stays okay. The person who knows about that is Nim Kidd, chief of the Texas Division of Emergency Management, which means he's a very, very busy man right now. So we appreciate him taking a few moments for us in Austin. Chief, I know your resume has a lot of really tough days on it. Do things like hurricanes and terror attacks, did that really prepare you for something like this we're seeing now?
No, Brian, I think all of our first responders that use the National Incident Management System and train for events of all hazards and all disasters, every part of their life up until this point has probably trained them for this moment. I say no two disasters are ever the same, but the management principles, the people, and the practices that we put in place help us be better positioned to manage any future event. So really hats off to all the first responders and the healthcare workers that are out there on the front lines taking care of us every day.
Boy, you bet. Of course, I know you've been moving some important folks quickly into certain parts of the state, particularly to the Amarillo area, talking about these surge response teams. Can you talk about the job that they're doing right now, specifically in these hot spots?
Yes, sir. So as Governor Abbott has laid out, the doctors and the data are the ones that are really driving our decisions. And as the data becomes more available, what we're finding is nursing homes, assisted living facilities, jails, prisons, and meatpacking plants are our three focus areas of where we need to be corralling the virus at this time. Meatpacking plants, a lot of reasons that happens and why we may not have had our arms wrapped around that yet, but the teams that are up there in the Panhandle right now are getting a real good handle on it. What we're finding is maybe 20% of the population that is positive is asymptomatic. And so if you don't feel sick and you're not having symptoms, you don't know that you're capable of spreading the virus. That's why it's so important that we get out there with the surge teams and actually start sampling on site and getting those results turned around as fast as possible so that we can make smarter decisions of how to protect ourselves, our family, and our community.
Sure. And here in Lubbock, we had a very high number of nursing home fatalities early on in this process. How have your teams been able to specifically make a difference in those facilities?
So that's been a great partnership, and it hadn't just been our teams that have been doing that. I think that's important to point out, that how the local first responders and the local healthcare providers right there in Lubbock have also done a great job in helping us identify where the need is, where the gaps are, and then standing up with the resources to be able to deploy. So we know, again, if for instance 20% of the population is COVID-19 positive but doesn't have symptoms, they may not even realize they're spreading the virus around. By getting the testing strategies in place and getting those results turned around, monitoring our fever whenever we get fever, but the asymptomatic people, very important that we get them tested so that we know how to separate out those that are positive from those that are negative. That'll be the key to slowing this down even more.
We've been able to see testing and facility work done in a lot of our rural towns and counties as well. It's much appreciated there. I know some of that done by Texas Guard members. Firefighters have been stood up to help here in recent weeks. Can you talk about the job they're doing?
Sure. So our local firefighter paramedics that work in and out of your community every day are part of a team called the Emergency Medical Task Force. We call it EMTF for short. That acronym has all 8 of the Department of State Health Services regions covered. And so you might have firefighters from San Antonio helping out in Lubbock, or you might have firefighters from Lubbock helping out in Houston or Galveston. It's part of that great organizational structure that all of our first responders participate in across the state. I think it's also important that we point out the private practice physicians, the hospital staff that's there, and really those private practice labs that are out there. We've seen an increase almost 8-fold in the number of lab results we're able to turn around in a 24-hour period. So the ramping up of this testing capability, not only on the front side from personal protective equipment and the swabs needed to collect the specimens, but also on the backside in the laboratories, that those lab technicians working around the clock in order to return those results back so we can have a better idea of how we're slowing the spread.
And with that in mind, can you speak to the work being done at Texas Tech to help in this fight? I know in the beginning there were some of the first doing lab work on some of these tests, right?
Well, not only that, they've done a great job in absolutely opening up something called viral transport media, VTM. The Texas Tech family actually started making this when we had a critical shortage, and we're using it statewide now. So really hats off to those guys and girls there that are making that happen for us.
And can you speak well to this? You mentioned the personal protective equipment and testing that's improved, of course, but where are we on the shortages of PPE or really any equipment needed for those folks when they're in the field and for our doctors and nurses and hospitals? Are you handling some of the supply chain problems with that?
So, Brian, our team is doing everything possible to rebuild that supply chain in partnership with the private sector and the federal government. Governor Abbott stood up a strike force very early on in this, where we brought in world-renowned experts to be able to look for personal protective equipment supplies internationally, not something that we normally do. So to date, we've produced a little over 40 million masks that have gone back out to healthcare workers, first responders, doctors' offices now, and working with dentist office to get them in. That's been matched by another 30 million masks that the FEMA air bridge has brought back in. The air bridge goes back into the normal supply chain, so the private sector providers that's actually putting that back out in our healthcare fields today. We don't hear as much of the PPE shortages. We believe there's probably still some isolated incidents of that, and we want to find those and fill that back up. And at some point, we want to get the public officials, the guys like me, out of the supply chain business and get that all back in the private sector.
Before we let you go, just one more. Do you have a goal for where you'd like to see Texas from a personal and business standpoint by, say, the end of June, or do you even think that far ahead at this point?
So we're absolutely thinking 45, 60, 90, and 180 days ahead, and what our strategy would look like for testing, for all of the people that may come in contact with somebody that is positive. How do we make sure that they get a test results turned around fast? Ideally, we see the supply chain filling back up and building stockpiles of inventory that may not have existed before to be ready as we look towards the end of this year and as we start looking into the traditional flu season, to make sure that all of our healthcare workers across the state have the right amount of personal protective equipment. We will continue with these strategies to make sure that all sectors are covered. But really, you know, the most important focus is taking care of ourselves today and our families today. We do still have to monitor our own selves, our temperatures, how we're feeling, any cough or any congestion, and be sure we're sharing that information with our family and loved ones. The way that we will get out of this is by talking to each other truthfully about how we're feeling and sharing that information with our healthcare workers and our local leaders.
Boy, oh boy, are we thankful for the work you're doing in Austin and all around the state. Nimkid, Chief of the Texas Division of Emergency Management. Thank you, sir. We appreciate you, and we will talk to you soon.
Thank you all very much. Keep up the great work.